Hello, everybody. My name is Marion Schatzbergen, and I've been a colon health therapist for over 40 years. And I have been treating people for intestinal problems, general colon detox, and deacidification of the colon. So you can say I'm pretty much experienced. And we have now a product, a ColonCleanse product, that we would like to present to you. This is because this is one of the very few products in the world that can eliminate a harmful biofilm in the human intestinal system. And this presentation will be all about what is this biofilm, why do we want to eliminate it, and how easy that can be done. So why would it be important to do a colon cleanse? Well, in order to be able to understand that very well, we have to understand that the body is a sort of a machine and it needs fuel and oxygen. And in this process, the body gets all sorts of fuel, which is our food, and oxygen, which is quite polluted nowadays. And this has a tremendous consequence for our health in this day and age. And I'm here to tell you how that affects our colon health and how it can pollute our colon. Here you can see that our body is, of course, very different from a machine, like my car, for instance, that also needs fuel and oxygen to function. But in contrary to our bodies, when I put the wrong type of fuel in my car, it will not run for another 10 meters. So it will stop immediately after that. But our body, if we put the wrong type of fuel and the wrong type of oxygen inside our bodies, it will still continue to run for the next 70 years. So what's the difference? Well, of course, we all know that. But the difference is that our bodies have a self-healing mechanism. So here you can see the capacity for self-repair. If I cut my hand, the body will start healing it instantly. If we break a bone, if the bone is not too far apart, but if it's still in place, the body will heal the bone. And if a virus enters my system, the body will start sniffing and snuttering and will discharge everything and will put up a fever. So the virus will be killed. In a perfect world, of course, because here we can see that this self-healing mechanism has a couple of blockades. That's why in case of certain viruses, our bodies cannot be effective anymore and our bones will not heal properly anymore. And even wounds sometimes don't heal very well anymore, and our immune systems will be not in optimum state. So how can that be? Because in a perfect world, our bodies should be able to heal themselves completely. Well, this self-healing mechanism has 3 types of blockades. So everything that can stand in the way of us and the perfect healing falls into one of these 3 categories. As you can see here, the first category is pollution. And when we speak about pollution, we mean not only chemical pollution, you know, insecticides, pesticides, heavy metals, and other types of chemical pollution, but we also mean pollution from viruses and bacteria, parasites. And we have quite a lot of them inside our body. And if the balance between the good bacteria and the bad bacteria is out, we get all sorts of infections. And that is in itself a blockage for the self-healing mechanism of the body. Next to that, there's also deficiencies. Too few vitamins and minerals because of the modern agricultural ways of producing our food. It is a scientifically well-known fact that we have nowadays about 10 times as less minerals in the soil as 100 years ago. So people that think they have a very healthy diet still get way too few vitamins and minerals from it. And that doesn't help for the body, because the body needs sufficient, ample vitamins and minerals to help the self-healing mechanism to function properly. And the third blockade would be electromagnetic frequencies. 40 years ago, when I first started to be a therapist, this type of blockade didn't even exist. But nowadays we have mobile phones, we have Wi-Fi, we have computers, we have microwaves, we have water beds, we have all sorts of man-made machines that emit frequencies that hinder the body's self-healing mechanism. So what you should actually do if you want your body to function properly is to help it to overcome all of these three types of blockades for the self-healing mechanism. Today, we shall focus on the first blockade, which is the pollution, and how that affects our colon. Here you can see, when we talk about the first blockade, the pollution, we can see that the human body encounters about 2,600 types of foreign substances every day. And with foreign substances, I mean toxins. The number might be way higher nowadays than this 2,600 figure, because every day new chemicals will be allowed on the market, and it goes faster than we can count them. These toxins are everywhere. So also people that only eat organic food will get massive amount of these toxins in their bodies. They are in the walls of our houses. They emanate all these toxins. Your furniture has been treated with flame retardants, which also fume in your house. Your carpets emanate fumes, even your laminate flooring. There is paint on your walls. There is all sorts of chemical substances in your clothes. People put all sorts of cosmetics on their body which aren't 100% naturally, which can be very toxic to the body. Toothpaste, deodorant, body lotion, and then we have people that smoke and eat diets of processed food, and it's all full of chemical substances, and our bodies were not designed to get rid of these substances, because our bodies were designed, hundreds of thousands of years ago, and they were roaming the prairie, our ancestors, and all they came in contact with was the food they found, like some carrots, some leaves, some fruits, some vegetables, an occasional rabbit or a fish maybe. But that was it. That is what our bodies are designed to detoxify, and nothing else. So all of these substances, they hinder our body a lot. There is a beautiful substance you can use that helps your body to get rid of all of these toxins, which is called fulvic acid. And if you find a quality of fulvic acid that is completely clean, because most fulvic acid can be a bit polluted, but there's also a clean form of fulvic acid, then it helps your body in the body cells to get rid of these toxins. But many people have never heard of that Many people have never used it. And what do these toxins inside your body do except for hindering your liver, hindering your kidneys, and hindering your general metabolism? It acidifies your body. So your body becomes too acid. Some people might have heard about the pH value of the body. And of course, different tissues in the body have different levels of pH. However, the blood and the urine should have a very set pH level, and otherwise the body cannot function. And if that gets a little bit over acidic, then that is a cause for many problems of the body. So what does this acidification of the body do? The problem with this acidification is that the pathogenic bacteria in our bodies, they love it when the body gets too acidic. Why is that? Well, here we can see that the body knows two types of bacteria. Of course, we have two types of bacteria. On one side, the pathogenic bacteria that can make you ill, and on the other side, the healthy bacteria, which assist us in our whole existence. We cannot live without healthy bacteria. We would die without them. And normally, in normal circumstances, the healthy bacteria, they keep the pathogenic bacteria in check. So if there's enough healthy bacteria, the pathogenic bacteria cannot grow way too much out of proportion. However, because of all this pollution, the pathogenic bacteria, they are really fond of an acidic environment, as where the healthy bacteria, if the acidity gets only a slightly bit too much, healthy bacteria will die and have a hard time to recover. Healthy bacteria are some sort of, I always call them like princesses on the pea. They are extremely sensitive. So if, for example, one night you have a ball and you drink too much, they don't like it. Some of them die. Why is that? Well, we can see that over here. Bacteria do not have a skin. So they have to have some way of protecting themselves from the environment. They use a layer of slime around them to have a protective coat. Healthy bacteria produce a very thin layer of slime around themselves, and they do not clump together, because clumping together is a mechanism of survival for bacteria. But healthy bacteria do not do that very well. So if the environment gets too acidic, it affects them tremendously because they cannot protect themselves well enough. Many of them die, and they don't keep the pathogenic bacteria in check as well as they are supposed to anymore. So if the body is getting too acidic, the pathogenic bacteria, their numbers explode. And this is not a good situation, because we all know pathogenic bacteria can make you ill, but there's also another disadvantage, and that is that pathogenic bacteria produce a thick layer of mucus around them. Their slimy layer around them is way thicker than what healthy bacteria do. And also, on top of that, they clump together, so they form a colony. Well, if you have the total sum of the pathogenic bacteria in the colon with their thick layer of slime around them, and they're in a colony, then we will get what we call a biofilm. So pathogenic bacteria create biofilm. Healthy bacteria do not create a biofilm. Healthy bacteria do not survive in a polluted body. Pathogenic bacteria, they thrive in an acidic environment and in a polluted body. So I was explaining that a colony of pathogenic bacteria forms a biofilm. What is a biofilm? A biofilm is a microscopical thin layer of slime, but a very thick and strong one. It has a texture. And our bodies, they know a couple of types of biofilms because it's very common to have biofilm in our body. Everywhere where there is humidity, there is some sort of a biofilm, not only inside bodies or on bodies, but also in our outside world. Biofilm is very, very common. If you have a vase with flowers that has been standing too long and you take the dead flowers out, you see this slimy, gooey substance on the dead flowers. That is biofilm. And if you look inside the sink, you know, where the water is drained, and you screw loose the drain, inside you see this gooey, smelly stuff. That is biofilm. And if you have your dishwasher, you take out the flat filter and you look on the lower side of the filter, there's also this white stuff underneath it. That is biofilm. And also our sewage system is always filled with biofilm. And the water company, they have their hands full on removing biofilms from the draining pipes because it grows and it grows and it grows and it grows. And that's one of the facts of a biofilm, that it's very hard to combat a biofilm and to eliminate it because it's practically undoable. And as I said, in our bodies, we know several types of biofilm. One of the most known types of biofilm in the human body is dental plaque. So that is why we have to brush our teeth several times a day to remove manually all the biofilm. And of course, hardly anybody realizes that what we are disposing of with the toothbrush every day is dental plaque, is biofilm. So then you can have some sort of image what biofilm actually is. But also in our sinuses, there's biofilm. And for people that have chronic sinusitis, this biofilm is stronger and heavier and more filled with bacteria than with other people. But the same counts for the urinary tract. Well, we all know some women, they have in their urinary tract or in their bladder, they have all these infections which they cannot get rid of, no matter how many antibiotics their doctor prescribes. It still persists, this infection, because there is biofilm. And it's very important to know that any bacteria that is inside a biofilm, you cannot touch, not with medicine, not with herbs, not with colloidal silver, not with MMS mineral to kill pathogenic bacteria inside the body. If a bacteria is inside a biofilm, it sits heavily protected and it goes, na, 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 you cannot touch me. So, which is true. If you talk to a heart surgeon about biofilm, he will turn white in the face, because for a heart surgeon, biofilm is his biggest enemy. Why is that? Because if you give people new valves in their hearts, after the operation, biofilm will develop, which means there is infection inside the heart. And it's really hard to control this infection because it's biofilm and it hardly responds to antibiotics, which is really critical for those patients. So for a heart surgeon, it's really disastrous if there's biofilm. And if there is wounds on the body, for instance, burn wounds, the doctors in these burn centers, they have an easier job, because usually if people have burns, there's a larger part of the body which has been affected. And when biofilm develops on a wound on the outside of the body, these doctors just take a couple of tweezers and they just peel it off, and they can pull off the whole layer of biofilm. For them, it's fairly easy to remove biofilm. In the other parts of the body, yeah, the tooth plaque is really easy to remove. However, the biofilm inside the body is really difficult to get rid of, especially inside the digestive tract. We cannot take a toothbrush and just brush clean our intestines. That is undoable. So what do we do about it? Okay, in order to understand how to eliminate the biofilm inside the human gut, we first have to see what a biofilm looks like and how it really works. Here we can see an example of biofilm which has been removed with the ColonCleanse product. And it is important to know that what we see here in the picture is not the form and the shape and the state in which the biofilm naturally occurs inside our intestines. The biofilm which we see here has been treated with the ColonCleanse product, and the ColonCleanse product is inside the biofilm and makes the biofilm swell, and it makes it moist and treatable. And I will explain all about that later. And this is actually my own biofilm. So please don't think we took some pretty picture from the internet. No, this is my own biofilm. And I can tell you about myself that ever since I was 18, I started to be a naturopath. And at that time, we were taught to be very cautious with the way we lived. So we had to do fasting programs every year. We had to do ColonCleanse programs every year. We were on all sorts of diets to experience what our clients would experience when we were treating them, etc., etc. And ever since, I have been living like that. And I was a colon hydrotherapist for 20 years. And I have given thousands and thousands and thousands of colon hydrotherapy treatments, but I never saw any biofilm being expelled. And I gave myself a lot of these colon hydrotherapy treatments as well. So when I first started taking the ColonCleanse product over 10 years ago, I had this arrogant idea of nobody can get something out of my intestinal system anymore because I am so clean and I've lived all my life eating organic food, and I have cleansed myself time and time and times again. And still, what you see here in the picture is what came out with me. So I was a bit flabbergasted for a couple of days, and then I understood that everything I was taught about colon cleaning was not correct, because obviously nothing that I ever used, nothing that I ever tried, none of these beautiful, elegant methods that I had been taught was working well enough to eliminate the biofilm from my intestines. And well, here you can see the shining example, as I can say. This is the skin around the sausage that you can see here. That is the biofilm, and it's darker colored because the product is inside the biofilm. And you can see that pathogenic bacteria always form a protective layer of mucus around themselves, and that results in having these transparent skins on the inside of your intestinal system. And it's only pathogenic bacteria that do that. So if you remove the biofilm from your body, it does not touch any healthy bacteria. None of the beneficial bacteria are being harmed with this product. So this biofilm, what consequences has its presence for our intestinal system? Well, first of all, it causes leaky gut syndrome. Some of you viewers might have heard about the leaky gut syndrome. Some of you might know what it is. And most people do not know exactly what it is. And probably none of you will have ever heard that the cause of leaky gut syndrome is the biofilm. So if you ever want to heal your intestinal wall, then you first have to get rid of the biofilm. Well, how does that work? I told you about the dental plaque, and there's an analogy about the situation in the mouth and the situation in our guts, because the mucous membranes in the mouth are pretty similar to the mucous membranes we have inside our guts. And if you don't brush your teeth for about 2 months, then you will see that your mouth, the whole inside of your mouth will turn white with this incredible white layer of goo, and the skin inside your mouth will completely dry out. Your tongue will feel dry. The white goo will come out of your mouth, in the corners of your mouth. Your lips will start swelling. There will be cracks in your lips and in the corners of your mouth. You will have canker sores inside your mouth. You will not feel good. And this is exactly the same situation that goes on inside your intestines because of the biofilm. What you see here, you see the cells of the colonic wall. And because of the presence of the biofilm, these little cells will swell up because they dry out and they start to get inflamed. And everything that's inflamed will swell up, just like a zit on your nose that will also swell up. And in the process of swelling, these little cells, they will come apart because they will all get bigger and they need space and they rip apart. And then your colonic wall will get tiny holes in itself, and then all types of particles which will normally be stopped by an intact colonic wall can now pass into the bloodstream. And that causes all sorts of immune reactions, and that will cause cold inflammation in the rest of the body. So also, if you want to do something about situations in the rest of your body, first start with removing the biofilm from your intestines. So what I was telling, that the biofilm will put a layer over your healthy mucous membranes. Here you see in detail how the cells of the intestinal wall are supposed to be covered by a healthy mucus layer. It's called the glycocalyx. We can forget about this word, but that's not biofilm. It's the same as the skin we have inside our mouth. That's a healthy mucous membrane with a healthy, normal, moist layer. This is the situation how it's supposed to be. However, you see here the walls of the intestinal system, the cells of it, and you see the healthy moist layer, the blue layer, is being dried out by the presence of the harmful layer, which is the biofilm. So it gets dried out. It's the same situation when the dental plaque grows out of control in your mouth, and it will start drying out your mouth. It's the same situation inside your colon. So here we have the system where the biofilm is covering your mucous membranes inside your colon. What can we do about it? How do we solve this? And as I said, the ColonCleanse product is specially designed to deal with this situation, and is the only product in the world, I dare say, that can help us to get rid of the biofilm in the intestinal system without damaging the colonic wall and without causing any worsening of a person's symptoms. So I will show you how that works. Here you see all these green dots with the arrows that are pointed towards the biofilm, and you can see the green stuff entering inside the biofilm, and you see the biofilm starting to swell. How does this work? So here we see when the biofilm is completely saturated with the ColonCleanse product, you see the green stuff inside the biofilm. In this case, the biofilm is completely saturated, it's completely moistened, and it can only attach itself to the colonic wall because of the dehydration of the colonic wall. Once the biofilm gets completely hydrated, it becomes very wet and slippery. Well, that's how the saying goes, slippery when wet. Well, that is the case with the biofilm as well. So it just detaches itself from the colonic wall, it releases, and it slides out towards the exit of our intestinal system. And there it sits and waits until you have the urge to go to the bathroom. There will not be any cramping. There will not be any horrible discomfort. Nothing, nothing, nothing. How is that and why is that? I will very quickly show you. The solution, namely, is the fiber of the bark of an oil palm tree. What is an oil palm tree? There's different types of palm trees. There's palm trees that produce dates, and there's palm trees that produce oil, palm oil. The palm oil tree, it has this webbing around it, and that's a type of wood which, if you ferment it, it will be suitable for human ingestion. If it's not fermented, it's just wood, and you should never ingest it because that's dangerous. But when it's fermented, you see these green dots. These are the fermented fibers of this oil tree bark. And that is the only product in the world that can penetrate the biofilm without damaging it. And that is really important. You should never damage or break open a biofilm all of a sudden. Because if you take away the slimy layer around these bacteria, what do you get left with? Nothing but harmful bacteria that then can enter the bloodstream and make the person very ill. So you don't want that happening. And some people have products based on enzymes that can break open a biofilm in the colon. You shouldn't do that before you do a ColonCleanse, because if you have never done a ColonCleanse program and you start taking enzymatic products, then all of a sudden the biofilm gets eaten by these enzymes, and the harmful bacteria, they get left and they all enter the bloodstream, and you have a huge problem. This product, however, these fermented oil palm bark fibers, they can penetrate inside the biofilm, and they take with them the powdered okra vegetable. I don't know if some of you heard of the okra vegetable. It's very popular in the south of the United States. People from South America also like it a lot. People from Suriname. It looks like a small zucchini. It's green, and it's a slimy vegetable. And if you dry it and powder it, then this powder takes on its own weight about 100 times in water. So the palm fiber penetrates the biofilm. It lets the okra powder travel with it, and it gets transported inside the biofilm, and the okra powder will start taking on water. So the biofilm will swell. It will get so slippery and so moistened, and also the colonic wall will get moistened. It's like a lotion for your colonic wall, and the biofilm will slide towards the exit. Well, that's a brilliant system, and there's only one ingredient in the world that can do that. Once you have removed the biofilm from your intestines by using this product, you can see that you have only gotten rid of the biofilm made by pathogenic bacteria. The beneficial bacteria remain unharmed. Beneficial bacteria do not make any biofilm. They are not treated in any way, shape, or form by this product. This product only penetrates biofilm, makes biofilm swell, and it gets expelled the natural way when you feel the urge to go to the bathroom. That's it. So we also have a laboratory test done on several people using the ColonCleanse program, and we had their levels of beneficial and pathogenic bacteria tested before and after the ColonCleanse program. And the majority of the people had a huge increase of their beneficial bacteria after the program, and a huge decrease of pathogenic bacteria in their guts after the program. So that is a beautiful system. So what does this program consist of? It's very easy. Here you can see there is boxes that you get when you buy the program. You have a program for 3 days, 6 days, and 12 days. And for every day you have one box. And inside this box, you can see there is 7 sachets which are meant to be taken throughout the day. So this is a meal replacement program, because the product works better if your body doesn't have to digest any food. So it's best to not take ordinary food, just take these sachets. These sachets are extremely filling, so we've hardly had anybody ever complain about any hunger feelings during the program. If any, people would complain about having to take too much and that they were so full, which is not a problem at all, because as long as you take the meal shakes, if it gets too much, you can leave out the snack shakes and the wake up shakes, because they only add some nutrients. The oil palm fiber and the okra powder is exclusively in the meal shakes, and there are 3 meal shakes a day. So 1 for breakfast, 1 for lunch, and 1 for dinner. You put it in a shaker, which mixes the product with water the best, because it has a thick consistency. You put 400 milliliters of water in the shaker, you add a sachet, you shake well, and you have to drink it straight away, otherwise it gets too thick. If there are any people who don't like to drink liquids that are a bit thicker, some people get nauseous from it, just divide the meal shake sachets in half and add them to also 400 milliliters of water. It will be much thinner, and it will be much easier to drink, and you don't taste anything of the product so much anymore. You are allowed, however, to add any type of flavoring that you like cocoa powder or stevia powder or some honey or some cinnamon or whatever you want to add to it to make it taste better. It's not absolutely necessary to dilute the sachets with water. You can also take apple juice or carrot juice or whatever you prefer. The program comes also with a booklet with tasteful tips, which will tell you what I just said. So it's very easy to take it, and people will be able to have a nice time even while they are using this very beneficial program for a couple of days. A 6-day program is intended to be the starting program. That's the best starting point. The 3-day program is meant to be as a repeating program. So after half a year or after a year, just like dental plaque, the biofilm will regrow depending on the way you live. And the 12-day program is for people which have a bit more of an extended abdomen or have more serious situations which require a 12-day program. And often, and this might be a good tip, people use the colon detox program as a starting point of a diet or an improved way of eating. Because after this program, you will not crave sweets or salty things or fatty things that much anymore. So it's a real good beginning of, to have a better way of eating. And who should not do the program? Well, that's fairly easy. Pregnant women, of course, because you don't want to risk anything. Not that the program could ever harm an unborn child, but you just don't want to get into that when you're pregnant. Lactating women, because obviously you are detoxing, so you don't want to have any pollution coming into the mother's milk. Small children, because you cannot explain to a small child why they can only drink that gooey stuff and not and cannot eat anymore. So the child has to be old enough to understand why he has to be doing that. Acutely ill people, so people with an acute disease, should not stop eating like this and start this type of program. Wait until the acuteness has subsided, and then there is a better moment to do the program. Very weak people, of course, should also not start a detox program which requires them not to eat. It's better to get a bit stronger and then do the program. However, some people that are not feeling so well and want to be careful, they can always start with a 3-day program just to be a bit cautious and still do the program. That is always a good idea. People that take medication should really check themselves to see if the medication is not getting to be too much. For instance, diabetics, they can do the program, but they should check their blood levels regularly, because it could be that they're taking too much insulin because they're not eating. And usually after 2 or 3 days in the program, the blood sugar levels will get balanced by themselves. So be careful to check yourself. But people with bleeding stomach and duodenal ulcers, they should be careful. Not that the product will harm their colonic wall in any way, shape, or form, but if you have bleeding ulcers in your intestinal system, they will form small crusts there will be some occasional bleeding for some people. And these crusts, when this bleeding will heal, they will become attached to the biofilm. And once the biofilm gets removed, it can cause a small bleeding, and you don't want to risk that. So there's different protocols for those people to make sure that they're first in remission, and then they can do the ColonCleanse program. So which people are allowed to do the program? Well, very easy. Everybody else. And who should do the program? Everybody else. Yes, but some people say, I'm living a very healthy life and I'm eating such a very healthy diet. So was I. Nobody was eating healthier than I was. Nobody was taking care of herself as good as I was, because I'm a trained health professional. I know all about diets. I know all about vitamins. I know all about minerals. I know all about colon cleaning. And yet, my biofilm was really beautiful when it came out. So yes, everybody needs to do it. Because of this product, everybody can do it. It's easy, it's simple, and it can even be fun. So just try it. So if you would like to take my advice, there is a special offer exclusively for those who have registered for this webinar. And you can scroll down and you can see how you can try the ColonCleanse with a special offer for yourself. And I hope you will, because it will be a life-changing experience. And I wish you very good luck with it. And also let it be a good start of an improved lifestyle. Okay, I say goodbye to everybody. Thank you for listening and see you next time. Bye-bye.